Right. So if you have read and understood, considering it surgical pathology station, kindly tell me, how would you discuss the differential diagnosis of patient's condition with patient?
My differences would be carcinoma esophagus,
Okay.
aplasia cardia, stricture,
Yes.
gastroesophageal reflux disease, or
Okay.
gastric stomach.
Okay. Right. What are the risk factors that might have led to this condition for this patient?
As for this patient, smoking and gastroesophageal reflux disease are the risk factors.
Yes. Yes. Right. If you can tell me, how would you define the term GERD?
There is gastroesophageal reflux disease
Yes.
when there is a reflux of the gastric contents repeatedly into the esophagus due to the incompetence of the esophageal sphincter.
What are the management options that you can offer to the patient?
For this patient, we have to first of all take the history and clinical examination, and then do the blood investigation as well as barium
Yes.
swallow and CT scan,
Yes.
and also endoscopy and biopsy.
Yes.
And once we state the disease, we have to discuss the management with MDT. And if it is a resectable tumor, we can do the resection. Otherwise, we can go for chemoradiotherapy.
Yes. Okay. What other investigations would you ask for this patient to confirm your diagnosis?
My investigation today routine blood investigations,
Yes.
barium swallow, gastric endoscopy and biopsy, CT abdomen and CT chest.
Okay. You've already considered that patient is having dysphagia to food and liquid. So how would you classify that to condition of the patient?
We have to do the TNM staging.
Okay. Can you explain, please?
TIS is high grade dysplasia, and
Yes.
T1 is tumor confined to lamina propria mucosa and submucosa mucosa. T2 is lesion extending to the muscularis propria, and T3 is lesion extending to the adventitia, and T4 is spread beyond the esophagus, and N0 is non-nodal metastasis, N1 is 1 to 2 lymph nodes, N2 is 3 to 6, and N3 is more than 7 lymph node metastasis. M0 is no metastasis, and M1 is distal metastasis. Then there is histological grading. Grade 1 is highly differentiated, well differentiated. Grade 2 is moderately differentiated, and grade 3 is poorly differentiated.
Considering the condition of this patient, how would you categorize to which level of differentiation this patient might be?
The patient is having dysphagia, ma'am. Probably the lesion is grade TNM at least 3 or 4.
Yes. Okay. Can you please tell me what is the most common type of esophageal carcinoma that you know of?
Most common type is squamous cell carcinoma.
Yes.
Others are adenocarcinoma,
If you
lymphoma.
can tell me, depending upon the location of the carcinoma in esophagus, how the management differs? Management of the patient. If carcinoma is diagnosed in upper 1/3 of the esophagus or middle 1/3 and the lower 1/3, what are the differences? What management can you offer to that particular patient in that situation?
Ma'am, I will come back to this question later.
Okay. Can you please tell me the blood supply of the esophagus, please?
Ma'am, I will.
Okay. Can you please tell me the pathological differences of the esophagus between upper 1/3, middle, and the lower 1/3? What is the lining of the esophagus?
Lining is non-stratified squamous epithelium.
Yes. Okay. So you've told me the term GERD, but what is the difference of eclesia? Or if you can define the term eclesia?
Never, I will come back to it.
Okay. Right. If you can tell me, in certain conditions, patient presents with hypertension, and there are certain blood vessels which can be involved, or the patient presents with bleeding. If you can tell me as a result of hypertension, so what are the conditions that can lead to vesical tears or bleeding from the esophagus?
Portal hypertension,
Yes, but I want you to tell me the conditions, if you can, please.
liver cirrhosis,
Yes, but which vessels are involved? If you can tell me in what particular situation and how that can be managed.
ma'am, I don't.
Okay, right. What lifestyle changes would you suggest to this patient?
I will ask the patient to stop smoking,
Yes, yes,
decrease the alcohol intake,
yes,
have a healthy diet,
yes.
also do regular exercises,
Okay. Can you,
and take
yes,
shorter meals.
take what? Please? Short,
Small meals, ma'am, to
small
reduce
meals. Yes.
the
Okay.
GERD.
Yes, right. What genes, if you know any, are associated with esophageal carcinoma?
No, no, ma'am. Familial adenomatous polyposis can be associated. No, ma'am,
Yes,
sorry, ma'am.
but any other genes that you know of which can be associated in particular with esophageal carcinoma? Okay, what treatment would you offer to this particular patient?
This patient, we need to stage the patient first, ma'am. After staging, we have to discuss the case with multidisciplinary.
Yes,
If it is confined to the mucosa only, then we can do the endoscopy
yes,
resection.
yes,
If it is T2 or T3, we have to do the resection of the tumor with followed by chemoradiotherapy. And if it is advanced like T3 or T4, then we have to do the palliative chemoradiotherapy.
yes, good. Right. What is the prognosis of adenocarcinoma of esophagus?
My 5 year survival rate is around 10%.
Okay. Is there any difference in gender or the age group?
It is usually seen after 70 years and in male patients.
Yes. Okay, good. Thank you. That has gone.
Thank you.